We testified last week on this very topic in the House on trying to get Oregon, which is like trying to move Mount Everest, to consider at least the idea, does a fetus, an unborn human being in its mother's womb, feel pain with mid and late trimester abortions in particular? So some beginning thoughts on the problem of pain. As you see, there's a picture of our Lord, and it's called Tears of Pain, as he's looking at a child wrapped in swaddling clothes. And you can imagine why he's crying. And I leave that up to your imagination. I'm going to talk in general about pain in general, the problem of pain that we all face as human beings, and then we're specifically, the last half will be on does the fetus, does the unborn human being in utero feel pain, particularly at the 5-month and greater gestational age. How do we know if anyone, human or non-human, feels pain? We know ourselves feel pain by experience. If we get too close to a hot object, we will definitely say, ouch. If we close the car door on our hand or fingers, we'll let out a scream. So we know from a direct experience that we feel pain. But how do I know that you're feeling pain? Is your pain tolerance the same as mine? Are you sedated? Are you taking pain medicines? We cannot directly experience anyone else's pain per se, because pain in and of itself is, for the most part, a subjective experience. But is it only a subjective sensation? Is it only an ouch, a simple reflex to a noxious stimulus? Is pain a perception? Do we have to perceive that it's secondary to a chemical reaction or substance P that is released when we squish our finger, and that substance P tells our brain we should definitely say ouch? Is cognition to be cognitive? Do we have to be, therefore, if we are cognating, conscious to feel pain? What about the emotional aspects? The consequences to pain. I've done this before. It hurt last time. Will it happen again? And will I feel the same amount of pain or even more pain or less pain now? Are there physiological changes? Does my heart rate go up, as they mentioned in one of those movies we saw at lunch? Does my pulse rate, changes in blood pressure, do my stress hormones go up, cortisone? Do my endorphins, our own natural morphine, are they elevated if I feel pain? Or is pain, as they say very simply, pain is in the brain? And we have to say, is that true? Is pain only in the brain? And when I say brain, in the cerebral cortex, which we'll talk about in detail. But this gets difficult with the last three. How do we determine pain if someone is unconscious? Was Terry Shriver in pain? She was supposed to be in a persistent vegetated state. Was she in pain when she heard her husband had a baby by another woman? Could she perceive that? Could she perceive when they turned her and she had a decubitus ulcer on her leg from lying in bed, and that hurt when they moved her? What about a laboratory animal? Does it hurt a frog to pith it? Does it hurt a dog when it hurts its leg chasing the newspaper's lady's car? It happened to our dog. I know what happened with our dog. We saw him retract and retreat into his own world. He had a broken femur, a broken thigh bone, by chasing the newspaper lady's car, and he literally was whimpering. And his body language, his dog language, was telling us that indeed he was in pain. Do animal rights trump human rights regarding the avoidance of pain? And lastly, what we're going to particularly talk about today is, does the unborn human being feel pain during particularly a mid or late trimester abortion? There's lots of ways, and I had about 10 quotes, but I just left it to about 3. And this is by William Shakespeare, which we're all familiar with, at least not necessarily this quote, but we're familiar with him. A wretched soul bruised with adversity, we did quiet when we heard it cry. But were we burdened with the weight of pain as much or more, we should ourselves complain. What's going on in 1/3 of the countries of this globe is, as I said in my talk this morning, the persecution of Christianity. 1/3 of all nations are persecuting, not just verbally or emotionally, but torturing and murdering Christians for their one particular reason. They're Christian. They are not Muslim, or they are not a religion that is wanted in that particular country. So that definitely, when you look at that, I think we can all say that there is definitely pain going on. Pain of fear of persecution, bodily harm, torture, and death. And it certainly would qualify for pain. We have spiritual pain. And this gets to a lot of people that have come to this conference who have had an abortion in the past. Half of our population of the women who have suffered, and men also who have suffered from post-traumatic stress related to pain. And this is taken from a quote of a lady, a very brave lady, who was at the National March to Life this past January in Washington, D.C. And her story is, one mother who was post-abortive was not consciously aware of her grief or pain for years, buried in the subconscious. When she finally opened her heart to her loss, she saw him, which was the aborted one, in heaven in a vision. And when I saw him, I knew he was immediately who he was immediately. I saw his whole personality, his potential, his impact on others in his life, and I saw that I was responsible for taking that away. Wow. That's spiritual pain. And we saw 2 lovely videos at lunch on that. So, how do we define human pain? Another quote first is, pain is not a sensation, it's an experience, and an unutterably lonely experience. And if we ever dealt with people who have terminal pain, if they have pain that has been chronic, as a physician, I can really relate to this. Ladies with infertility that have endometriosis, and every menstrual cycle is a reminder of their infertility and their pain. And they say, when is it going to stop? And can you do anything for me to help me? Not only with my infertility and the pain of the loss of fertility, but also with my pain that incapacitates me every month. Human pain. I didn't make this up, this definition. It's by the Institute or International Association for the Study of Pain, ISAP. And they define it as it's an unpleasant sensory and emotional experience. So it has 2 components, a physical hurt, sensory, you're perceiving something as hurting, caused by injury or potential of injury or disease, and emotional suffering. Animal pain. Animal pain has been described as an aversive sensory experience representing awareness by animal damage or threats to the integrity of that particular animal. Now, when I testified last week in front of the House, I was trying to make the point that over 45 years ago, The Congress of the United States declared that we should not have our animals be in pain. And it started with one case. It was before Michael Vick and the famous dog fighting scenario. But it was a man who had lots of dogs who was mistreating them. And that case was then finally brought forth, and the Congress of the United States said, we need a rule, a law in our land to protect animals, particularly those in research or being exhibited, transported, or by dealers, to protect them from pain. So we have a law in the book right now, 45 years old, that protects animals that I've just described from pain. It did not go far enough for some of the animal rights activists who say that we should not pith frogs anymore. We should not dissect earthworms in high school. We should not do surgeries on monkeys up at the medical school or other various lab animals. So the law does not protect lab rats, mice, cold water vertebrates, which is a frog, fruit flies, worms, or animals used for food. But it's still a law that protects particularly cruelty to the animal kingdom. There are now 32 different animal rights organizations, and some are absolutely insane, and others are, for good reasons, trying to do good to help our part of creation, the animal world. The USDA, now this is interesting, defines a painful experience for an animal study, something reasonably to be expected to cause more than a slight or momentary pain, distress in a human being to whom the procedure was applied. So the USDA is saying, if the animal is whimpering and we cause it, whatever we do to make it whimper, then it should be the same type of stuff that when we see a human being whimper. So we're using as the standard for animal pain its human counterpart. And yet we have no law on the books today except for 3 states, Nebraska, Oklahoma, and Idaho, that have passed a fetal pain relief scenario. The U.S. Guide for the Care and Use of Laboratory Animals defines parameters for animal testing, and it states the ability to experience and respond to pain is widespread in the animal kingdom. Pain is a stressor, and if not relieved, can lead to unacceptable levels of stress and distress in animals. So they're trying to say, even now with the laboratory animals, we should look at it differently. There are now virtual reality videos. Instead of dissecting the bullfrog that we did when I was in high school and college, we have a visual reality program that you can do it on the computer without eliminating a life of a bullfrog. So some people think that's wonderful. I have no problem with that. But the question is, where is the human being in that equation? Our good friend, Dr. Peter Singer, he is an animal rights activist. He holds the chair in ethics at Princeton University. He's from Australia. And he has in the past stated that animal rights trump human rights. And therefore, he's for infanticide. Because he said in order for a human being to feel pain, it has to be aware that it is it that is having the pain. So if its name is Bobby the baby, Bobby has to realize that Bobby is the one having the pain, not Mary, the little girl in the bassinet next to him in the nursery. And because the human being can't do that, even when it's born, for a while, to realize it is I that is having the pain, Peter Singer says animal rights trump human rights. And therefore you can infanticide, you can kill human beings after they're born, up to the first few months of life until they reach that wonderful philosophical, psychological term of sentience, the ability to know it is I that is having the pain. But he also is an animal rights activist, as I mentioned. And so it is said, if it is justifiable to assume that other human beings feel pain as we do, is there any reason why a similar inference should not be justified in the case of animals? I have no disagreement with that. It doesn't take a rocket scientist to see our dog hurting when hit by a car. Nearly all the external signs that lead us to infer that the animal is having pain in other human beings can be seen in other species, especially those most closely related to us. So we get down to the laboratory, and I forgot my frog. It's in the room. And I promised Gail I would bring it because I couldn't use it last week. They would not let me use any props. But I have a beautiful teddy bear frog that a lovely lady I give communion to on Tuesdays. She's a shut-in. She has 12 different frogs, and it's in my room. But anyway, you can imagine a little frog here. And the question is to pith or not to pith. Right? What do we do with partial birth abortion? We pith. What do we pith? A human being. And so when we had the partial birth ban, all they did now was they said, all right, you're going to say it's unlawful for us not to pith. We'll kill the child first by injecting directly potassium chloride or digoxin into the heart muscle of the infant. It is dead. And then when it's dead, we can pith it. So that's how they got around the partial birth abortion ban. But I had a rubber 5-month-old human being, fetus, and also a frog. And my point is, if we can protect or start making laws that protect the pithing of frogs, and we have a law in the books 45 years old protecting animals, where in the hell are we in protecting human beings? And that's the basic question. So the question is, does the pithing of a frog in a lab carry the same moral relevance as pithing a human being? Do you have to be a congresswoman or a man to realize there is a difference? Or do we use our eyes, what God gave us, and our observational skills to say that there is a difference? So there is a frog ready. It's been pithed, and when it's pithed, it's quadriplegic because we sever the spinal cord as it goes through the foramen magnum, the hole in the skull, and so it doesn't feel any pain. Now you can dissect a frog in the laboratory painlessly because it has no feeling. Its spinal cord has been severed. Is there a difference between that and the 5-month 4D ultrasound of a 5-month-old human being? And this is the picture I wanted to show, and they would not allow me to do that last week. We come to the ultimate question then, why we're here this afternoon. And that is, does a human being at 5 months or more, does it feel pain when it's aborted? Now, there's many ways of doing an abortion at 5 months and beyond, some of which are now removed. I have a picture, and I did not bring it, of a human being aborted after a saline injection into the amniotic fluid, which causes third-degree burns of the skin. And so the baby is black and charcoaled like it had been on a barbecue pit. Thank God that technique is not used that much anymore. We've had partial birth abortion, which pithed and then removed and sucked out the brains because the head is always the largest part. And we have now ruled that out because now they can directly kill it with injecting the heart with various substances to directly kill it. We're left with the gold standard, and I use those words facetiously. The gold standard of mid-trimester abortion is a D&E, and dilatation and extraction. And here we are dismembering a human being. There is no way to remove body parts in toto with the D&E unless you dismember the arms, the legs, the torso, and crush the skull. It is barbaric, to say the least. The fourth way of inducing an abortion is preterm or pre-viable, not termination, pre-viable stimulation of labor, knowing that the child will be born so young it cannot survive outside the womb, and that's usually between, right now, under 22 weeks. So it's delivered intact with that technique and can be alive at birth or not, depending. Now I'm going to keep neurology, this is neurology for students, because I could impress you with big medical words that I could have a hard time pronouncing myself. I'm not here to do that. But basically we have, these are nerve fibers, they're called axons, and they're myelinated, and they're big, or unmyelinated and thin and small. Myelinated is that wrap around them, and if a nerve impulse goes up, the ones on the right-hand side, the big fat ones, the biggest three in yellow, they go about the speed of a jet plane, about 500, 550 miles an hour. If a pain impulse goes up on the red, the unmyelinated small fiber, about 3 miles an hour. Big difference. And that's when you hit your hand with something, you're going to be stimulating your myelinated nerves first. And then that's going to go to your spinal cord and up the spinal cord to your thalamus, which is in the midbrain, and finally to your cortex, which perceives, you know what? Somebody just stuck my foot. And so therefore perception is done. So when we talk about pain, the first part up here on the upper is called a spinal reflex. And probably at 8 weeks, all we're going to see on the unborn is going to be a spinal reflex. If you stick a needle into an infant for whatever reason to draw blood from it in utero, it's going to retract its foot. And you're going to see that by retraction, it's going to send a message to the spinal cord. The spinal cord is then going to send an outgoing message that hurts, and I pull back my limb. That's happening during the first 3 months of pregnancy. But as you get older in utero, you're going to come to be, and not only is this little arc a simple reflex of an ingoing and outgoing message, you're going to then have it go up the entire spinal canal, the spinal cord to the thalamus, and perception will restart there, and then finally it'll go to the cortex. Another way of looking at it very simplistically, we're not here to teach you rocket science, but just simplistically. This is the neural pathways in order to perceive pain. Number one, on the foot, you need some receptors in the foot to say, ouch, it hurts when you stick a pin there to draw a blood sample. It's going to go to number two, which is the afferent nerve transmitting a signal to what? The spinal cord. Three, it's going to go up the spinal cord to the thalamus, which is labeled up there in the brain. Four, it's going to then have a somatic, meaning peripheral skin, cortex, pain perception, and then limbic system is affective, emotional aspect, and a number of descending going down 6 now are coming back to either modulate that pain, saying I'm going to give myself my own endogenous morphine called endorphins, and therefore the pain will be less. Now that is kind of in 6 simple steps all you really need to know about pain, perception going up, and then what does the body do on the path going down. So when we talk about the unborn human during a late-term abortion, scientific facts not in dispute. Both sides say we don't have a problem. One is that there are pain receptors called nociceptors in the skin and in the lining of your gut They're there. They start around the mouth, around 6 to 8 weeks of life. And they spread to the face, to the arms and legs. And by the 16th week, 4 months of intrauterine life, all those little pain receptors in the skin and in the gut are present. No one denies that. And no one denies that a spinal cord can receive those messages, that there is a thalamus that can say, yes, I'm perceiving pain, and a subcortical plate, which is present only in the unborn. It's a temporary structure. And subcortical means it's below the cortex. And what separates us from the animals is our big cerebral cortex. And we have heard, and I heard in medical school, that you need the cerebral cortex, the gray matter, to perceive pain, because that makes you perceive it and be cognitive of it and realize it is me that's having the pain. Also not in dispute is about information about touch and pain is transmitted to the spinal cord versus those yellow nerves I showed you before. And they're alpha, beta, delta, and C fibers. The C fibers are those little skinny ones that this is why physical therapy works. Why? When you go to physical therapy and you've got a pain, and that's going up your spinal cord, that's going to tell your thalamus and your your cortex that you're having pain. What does massage do? It stimulates the C fibers. And so you have a gate theory of pain which blocks that pain going through. And that's why massage feels good, or heat, when you have physical therapy. By 8 weeks post-fertilization, just by observing that little unborn child in utero reacting to a stimulus of a needle going through the amniotic fluid that hit its foot, can be recognized as painful if we use the criteria of observing and retracting the foot as it would be in a newborn infant or a human. The question is, does it go all the way to the cortex or subcortex at 8 to 10 weeks? Probably not, because those connections aren't there yet. But we do know, and Dr. Liley is the father of fetoscopy, which is surgery on the unborn. And he did a lot of seminal work on Rh-negative babies that had to have an intrauterine transfusion to survive. Their mother's blood type was incompatible with theirs, and she would break down the baby's blood cells, and they would have to be transfused in order to have a chance to live. So we know that another seminal study in 1994, that's not long ago, that's less than 20 years ago, by Glover in the UK, showed that when you do an intrauterine transfusion in an unborn infant, their cortisol, their stress hormone, went up 183%, their endorphins 590%. And it was even greater than shown in preterm neonates born that were under light anesthesia when they had surgery. So we knew at 18 to 20 weeks, definitely intrauterine life was able to have a physiologic response to a painful stimulus. And that physiologic response was increased stress hormones and increased its own morphine. And lastly, there's no debate about is that fetal anesthesia now given, and I'm old enough to remember that when I did circumcisions as an intern, we didn't give any of those male infants anything for pain. But I was told that they don't feel pain. I was told that by professors. Newborns don't feel pain. So I put this 1-pound stainless steel Gonko clamp on his penis so it wouldn't bleed, and then I would take a knife and remove the foreskin. And it would wail all the way through. We had little Velcro straps on its little arms and legs. And when I was through, it may wail and cry for not a long time, but a significant amount of time when it went back to the nursery. But I was told it doesn't feel pain. They were wrong. they were wrong. And I was told wrong. And that was only, less than 40 years ago. So they had neonates that had to have surgery. They would give them oxygen only and muscle relaxants only, so they were paralyzed but didn't move up to 30 years ago in the 80s. Because they figured if we gave it pain medicine that it would be an increased risk for them dying. And they wondered why the neonates came back from surgery looking like death in the ICU until they recovered. And a lot of them didn't recover because we were told they didn't feel pain, and we, the doctors, were wrong again. The seminal study on that was in 1989 by a wonderful doctor, Dr. Aman, who showed that by giving simply fentanyl, which is a narcotic, given directly to the neonate when it has its surgery, believe it or not, increased its survival rate. And they didn't look like death when they came back to the ICU. And their post-op recovery was good. We have seen now studies that human beings operated on without any anesthesia can have lifelong negative results from undergoing that traumatic experience. They may not remember it, but they certainly can respond to that negative event. Again, going back to the animals, Dr. Varner said these are the 6 things that you need as an animal to be able to experience pain. And again, I'm a little redundant. You need the nociceptors, the receptors in the skin. You need a central nervous system, a brain. You need the receptors to be connected to the spinal cord that is connected to the brain. You need your own endogenous opioids or endorphins to modulate, to decrease the pain. You can respond, the response of pain is modified by giving the animal pain medicine. And the response to damaging stimuli is analogous to what humans feel. And yet we still not have a law that says, do human unborn infants feel pain, and can we protect it rather than kill it first? Another bit of information we found out is that modulation of decreasing pain is immature in the unborn infant. In fact, between the 20th and the 30th week there at the bottom, it doesn't have the ability to adapt or dampen the pain experience. So one could make a case that a 5-month mid-trimester abortion, that infant, that human being will feel more pain because the modulation of pain is not there. It's not there until usually after birth in full bloom. Now comes the dispute. We've had 3 studies, 2 by the Royal College. I love this, the Royal College of Obstetrics and Gynecology from the UK. Doesn't that sound so pompous and so true, right? If they say it, why don't we believe it? It's the argument of authority, like I mentioned this morning, just like our American College of OBGYN or the AMA says, or the American Bar Association says. And we use these, and we have to realize that 10,000 people belong to the Royal College of OBGYN, and about 2/3 are living not in the UK. And that really it was a panel of 14 experts, of only 3 of which knew anything about or studied in their professional lives about pain perception on this panel of 14 that came to the conclusion last March of 2010 that before the 20, they did say originally 26 weeks, but now certainly before 24 weeks, there is no way that the unborn infant could feel pain. They did better than the American study that said 29 weeks, and our own American College of OBGYN simply stated, as I said this morning, no way does an infant inside its mother's womb for 9 months feels pain, period. And that's about as scientific as nothing. Okay, but again, it's a select group. It's not the 30,000 doctors in the ACOG. It's a select group that makes this stupid, unscientific statement. Now, the reason why they said that is three things. They got psychiatry and philosophy involved. And they said the fetus has to realize as it's being dismembered, it's me that's being dismembered. So they use this super criteria that is never used for animal research destruction. Also, it has to be cognizant. It has to be awake. And we know in lambs and sheep that they have this hormone that keeps them asleep. So who's to say that they don't feel anything because they're sleeping? Now, they did admit that in the studies in sheep, when they lowered the oxygen level, there was no stress hormone released from the sheep. And they did admit that lowering the oxygen is probably a little bit different than dismemberment. This is the Royal College of OBGYN. This is the same college now who said that there's no post-traumatic stress syndrome from post-abortion. They've also said that there's no problem with premature delivery after abortion. So they are using the argument of authority only, and the scientific facts are not on their side. Their main point, and I'm going to close with this in the next few minutes, is the cerebral cortex necessary for pain, for perceiving pain? It is I that's having the pain, and yes, it hurts like heck. We go back about 50 years, and two wonderful British neurosurgeons by Penfield and Casper, treating epilepsy, which was very resilient to any medical therapy, they would take out parts of the cerebral cortex. In fact, sometimes they took out half the brain to control epilepsy. And what they found is that while you could take out large pieces of the cortex and the pain perception is not changed. But isn't pain perception all in the cortex? And if you remove half of it, wouldn't that change your perception? It didn't. And so they found that the subcortical plate, which is only found in the unborn, not in the born human being, while anatomically subcortical in location, is functionally supracortical in its a way to manage pain. They found that the mechanisms for consciousness are not exclusively cortical. A Nobel Prize laureate by the name of Edelman has said that. And multiple lines of evidence collaborate that the key mechanism of consciousness is not related to the cerebral cortex. Again, this is what medicine has been saying for 30 or 40 years. Merker, and I love this, and my wife will, where is she? Anyway. She always knocks the Swedes because I'm Swedish. This is one good Swede, Bjorn Merker, did this lovely study on children. I'm going to show you a slide, born with hydroencephaly. They're born without either cerebral cortex. And I will show you what they respond and how they respond. They do not, they're born with nothing there in their head. And what he found is that they can respond to familiar people. They can recognize mom and dad, their little brothers or sisters. They can respond to hearing. They can respond to familiar or dissimilar environment. Can they speak? No. But they can certainly use other ways of their senses to respond to human contact. And so he found that despite total or near total absence of the cortex, they possessed discriminative awareness without a cerebral cortex. This was in 2007, and also that's just 4 years ago in 1997. They are capable of social interaction. And here's the key. These children respond to pain exactly as their brothers and sisters who were born with the cerebral cortex. They need to have fentanyl or narcotic given to them if they have an anesthetic Otherwise, they will feel severe pain. And yet, they are born without a cerebral cortex. She's my darling. And she's holding her little brother. And you notice the change in her expression when she holds her little brother. The little brother's placed in her arms and she's looking up to mom and dad. And this little girl, that's her MRI, and that black area represents where her cerebral cortexes should be, is not there. So when the Royal College of Obstetrics and Gynecology say to you that you must have a cerebral cortex in order to perceive and understand pain, Bjorn Merker, a good Swede, says, have we knocked the scientific world on its rear end? In summary, 45 years ago, the U.S. Congress decided to limit pain and suffering experienced by animals by passing a protective act for animals. Visual reality dissection of a frog now recommended for students versus actual pithing of frogs or destroying a frog by dissection. Dr. Amann has said the brain is not a light bulb. It's not turned off just by this. At 20 weeks and 4 days, it can perceive pain, and 20 weeks and 3 days, it can't. It's a gradual thing. And the unborn infant has this tremendous ability to use whatever anatomy it has to be able to adapt to its environment and feel or discern pain as it gets to be a big boy or a big girl. The unborn human being is very adaptable in using various neural structures not located per se in the cerebral cortex for pain processing as it matures. And this makes it unique and different from those of adults. It is not a mini adult while it's an unborn infant in the mother's womb. It's using other neurological anatomical structures to perceive. Scientific data over the past 10 to 15 years brings into question the long-held premise: is the cerebral cortex necessary for pain perception or consciousness? If scientists and researchers use reflex criteria, we go now back to pithing a frog, and it jumps. It does this when you bisect its spinal column. And they use that as a criteria. Why do we have to use the philosophical, psychological phraseology that say that it has to fit this criteria for humans also to be considered equal in pain management? 50 years ago, scientists were wrong when they claimed the newborn didn't feel pain with circumcision. We now give local anesthesia. 30 years ago, scientists were wrong when they claimed a newborn didn't need pain medicine and anesthesia for surgical procedures. Only oxygen and muscle relaxants were given so the infants wouldn't move. René Descartes, 300 years ago, said that the animal can't feel pain. It's not rational. He also was wrong. And it was the start of the so-called Enlightenment. And today, scientists claim that the unborn infant does not experience pain before the 29th, 26th, or 24th week. They have a 5-week leeway there, depending on what the author has read, since the neocortex is not mature. And today, we're asked to determine if there is a fundamental difference. Is there a fundamental difference between the pain experienced by a lab animal and the dismemberment of a human being? And I end with this quote. And this is by Dr. Amann. And he said this on CBS News a year ago. No one is as blind, I should say as doctors, as someone who does not want to see. Fetal pain does occur, and science would be better served if we acknowledge this capacity of conscious sensory ability in the human unborn. Thank you. And the last slide, talking about pain. We need to pray for our brothers and sisters in Japan. you talk about pain.